times in a 6-month period, people search the tribal resource tool. There are more than 900 resources in the tool that are specific to American Indian and Alaska Native victims and survivors of crime and abuse. And we'll talk more about who all is included in that group as we go along. It's not all tribal shelters or tribal victim service programs. It's other services that victims might need. The tool provides information on victim services via the searchable database. All you have to do is log on to the website, and the address is on your screen there. And by visiting the website, you'll find services and providers that may help American Indians and Alaska Native individuals recover from crime and abuse by providing that wide array of resources that I mentioned. These may include law enforcement, mental health providers, medical services, crisis response, shelter advocacy, and so on. Next. And I'm Gail Tome. I have the privilege of being the project director for the Tribal Resource Tool, and my information is on the screen for you here. I'd like to invite you to please share your name and your contact information in the chat box. It's always fun to see who else is on the call with us. NCVC is where I'm employed. That's the National Center for Victims of Crime. And we are the grantee from Office for Victims of Crime, or OVC, and for the Tribal Resource Tool. And you may sometimes lovingly hear us refer to it as the TRT. The National Center for Victims of Crime is a national leading resource and advocacy organization for crime victims, survivors, and those who serve them, you who are on the call with us today. NCVC's tribal unit is the host agency for the Tribal Resource Tool. Today, you're going to meet our team, and we'll cover the history of the TRT and our current day partnerships. And you'll notice that we emphasize the value and importance of collaboration of our team, our partners, and the sharing of information to reach a broad audience of service providers. Tomorrow, in part 2, we'll focus on using the Tribal Resource Tool as a resource to help victims and survivors, and especially to help you that might be serving victims on a routine or daily basis. Tomorrow, we'll also discuss the research and the 3 reports that are being conducted by National Congress of American Indians. This is interesting information. I think you'll be very excited to hear the information that you're going to hear about. And tomorrow we'll also talk about the future of the Tribal Resource Tool. If you have questions as we go along, please feel free to put those in the chat box, and we'll have an opportunity to address them at the end. We actually have, next please, next slide, and next one. We actually have a twofold purpose with the Tribal Resource Tool. That's providing the listing of services that I've been talking about, but also to identify gaps in services and how those can be addressed. In the webinar tomorrow, we'll discuss in detail some of the different search options that we have in the tool, and you'll find that we have information for all ages of victims and survivors, that we have information for all forms of victimization, which also includes missing and murdered Indigenous relatives and human trafficking, for all locations both on and off tribal lands, and for all needs of victims and survivors, such as justice, safety, healing, and support. And now I would like for you to meet our team. And if you all would just share your name and your agency and your role with the Tribal Resource Tool. And Renee, let's start with you.
Hi, my name is Renee Bork, and I am a citizen of the Muskogee Creek Nation, located in Okmulgee, Oklahoma. And I am currently the program manager for the Tribal Resource Tool for the National Center for Victims of Crime.
Hello, my name is Bonnie Claremont. I am a citizen of the Ho-Chunk Nation, and I work for the Tribal Law and Policy Institute. We're based in West Hollywood, California. My office is in Minnesota, in St. Paul, Minnesota. And I've been with Tribal Resource Tool since the beginning, so I'm sort of the historian, as they say, but welcome to the webinar.
Hello, everyone. Oh, looks like the Zoom named me Bonnie as well. I'm gonna have to change that. Good afternoon, everyone. My name is Heather Torres. I'm a citizen of San Alfonso Pueblo and a descendant of the Navajo Nation. I work for the Tribal Law and Policy Institute as our program director, and I'm part of the TLPI team assisting to outreach and enter programs into the tool, as well as providing tool maintenance. Thank you so much for being with us today.
Hi everyone, I'm Abby Thonis. I also work for the Tribal Law and Policy Institute. I office out of the Minnesota office with Bonnie, and I assist Bonnie and Heather on all the program outreach and entry of the Tribal Resource Tool from the TLPI side.
Hi, everybody. My name is Kelby Kennedy. I'm a citizen of the Choctaw Nation of Oklahoma. I'm a policy counsel here at NCAI, and I actually hail from Buffalo Valley, Oklahoma, but NCAI's office is primarily stationed in DC. Gwen, I think your sound cut off when you were in the middle of introducing yourself, so if you want to unmute yourself, we'll do an intro from Gwen, and then we'll turn it back over to Renee. And if not, Gwen and I are going to introduce ourselves a little bit later on in this presentation, so we'll just turn it back over to Renee at this time, if that works. Oh, no!
Okay, so this is the wonderful thing about being live, right? Uh, so as you heard, our project partners are the National Congress of American Indians and the Tribal Law and Policy Institute. We would also like to do a shout out to Strong Hearts Native Helpline, who also worked with us in populating our tool, and we're very appreciative for their valuable input. They were involved in recruiting resources included in the tool, and they remain a part of this project. The goal of the project has been to develop a web-based tool to connect American Indian, Alaskan Native victims and survivors of crime and abuse to resources anywhere in the country, regardless of your location, to help them rebuild their lives. Please feel free to share our info widely, and I know I've seen a lot of people on the chat that I've already reached out to, and I'm still coming for some of you to make sure we get you in the tool. Bonnie is going to emphasize the value and importance of collaboration of the Tribal Resource Tool partners and the sharing of information that we've used to broaden our audience for American Indian, Alaska Native service providers. We have trauma-informed, most effective, victim-centered services, and that is our primary goal in everything that we do, right? Bonnie is going, like she said, she's our historian. She's been here from day one. She was included in the very beginnings of discussing how the tool was going to come to fruition, meeting with the stakeholders. So she is not only like our grandma to everyone, but she is our historian, and she keeps everybody in line with what the original intent of the tool was. And I'm happy to say that it's due to her involvement from day one is why we've been successful in maintaining what the stakeholders originally wanted.
Excuse me for interrupting, but Megan, I forgot, it's my fault. I failed to ask you to advance the slides, so we're a couple behind.
Oh, are we? We are, sorry.
Okay, so we're ready for Bonnie now.
Okay, well, I want to talk a little bit, like Renee said, I want to talk a little bit about the selection of our stakeholders, reaching out to stakeholders. At TLPI, we spent a considerable amount of time just talking about where we were going to do our outreach, the kinds of people that we wanted to consult with, the kinds of skills that we needed at the table, the kinds of experience. And so I want to share with you the results of our brainstorming along with our partners at TRT. So we had elder abuse in mind, so we wanted to bring people who have that background. So we invited or reached out to the National Indigenous Elder Justice Initiative. And we also really feel that tribal coalitions that provide training and technical assistance to tribes on domestic violence, sexual assault, and so forth across the country really were needed at the table because of their knowledge and expertise in working with tribal communities around these issues. So with that, we invited the Native Alliance Against Violence, located in Oklahoma. We also wanted to have legal experts, tribal legal experts, those familiar with tribal laws, federal Indian laws, and so forth, and victim rights, and so forth. So we invited the Native American Rights Fund, the Tribal Justice Institute, and the National Tribal Judicial Institute. These are all colleagues and people who we worked with, so we really know the skills, the experience that they would bring. We also wanted to include people from tribal health, those that are familiar with the health concerns, and especially around healing and wellness that are needed often by victims of crime. So we reached out to the National Council of Urban Indian Health, and also to not exclude our relatives, our Native relatives that live in urban areas. So we also had that as well on our list of people that we wanted to invite. We also we wanted to include people that have experience around child abuse issues. So we invited staff from the Witchoni-Wawokia project located in South Dakota. They have one of the first child advocacy centers there on the reservation. And again, like I said, we wanted to involve the coalitions, tribal coalitions across the country. So we invited the Minnesota Indian Women Sexual Assault Coalition. Next slide. And also the National Indigenous Women's Resource Center. They're a national training and technical assistance resource center, and really have a lot of contacts across the country, especially organizations, programs that work with victims of domestic violence, sexual assault, stalking, murdered, missing Indigenous women and girls, and sex trafficking. So they were a really important entity at the table. And like I said, those involved in the issue of child abuse, so we invited the Tulalip Tribe's Child Advocacy Center, and also those that have skills and experience around child welfare issues. So we invited Tribal Star, they're a TA provider around child welfare issues. And also folks from the National Domestic Violence Hotline. It's a mainstream hotline in mainstream, but they have a lot of experience developing a national hotline and really knowing how to set up a national resource, a resource that has a national focus. And also the Mending the Sacred Hoop, the Southwest Indigenous Women's Coalition, the Alliance of Tribal Coalitions to End Violence. These are all agencies that provide training and technical assistance around issues on violence against Native women. And also the Tanana Chiefs Conference that's located in Alaska. They provide a lot of resources around health issues for Alaska Native folks up there. And also the Casey Family Programs. They provide a lot of training, a lot of assistance around the issues of Indian child welfare. So this all took a lot of time internally, but we also wanted to also wanted to include folks from the grassroots organizations, those that are working on the ground, and community stakeholders like that, because they really do have a good sense of the kinds of resources that are needed, how to access those quickly through this type of a tool. So we always kept that also at the forefront of our planning. And with that, we were able to have focus groups to seek their input on the development of the tool. And we felt this was important to really provide a sense of ownership over the tool to our folks in tribal communities who are working at the community grassroots level. So this was all really time-intensive work and a lot of thought that was given to really identify those folks that we wanted to make sure that we had contact with and we did outreach to. Next slide. So we did, initially it involved a lot of emails where we shared information about the tool, you know, really saturating the communities out there with what this tool was designed to do and how best to design the tool that would really meet the needs of those working with crime victims. And so we did that weekly, perhaps 1 or 2 days a week. We spent just inviting stakeholders, informing them of the tool, sending them materials, emailing materials, and then just inviting their input. And after we developed the website, we also shared that link so that they could see what was happening with the tool. We did a lot of in-person contacts. When I would do workshops at conferences, I always included a couple slides on the tool so that anyone within my workshop or wherever I was presenting, those participants would receive information about the tool. So that was, at that time before COVID, I did a lot of traveling. So I was able to utilize that opportunity to get information out. At those conferences, we also tabled. We had a table of all of the resources that were developed, the branding materials, the palm cards. We had a little flag, a tabletop flag, as you see in the image here on the screen, just to be able to have people recognize the graphic, the logo for the Tribal Resource Tool. And a lot of thought actually went into the design of the logo. We sought a lot of input even on the design of the logo. As you see, there's a circle in the middle. A circle is very important. Everything revolves in a circle. And there's arrows out to the 4 directions, which really symbolizes our outreach to, you know, all tribal representatives in all of these areas to the 4 directions. And I really like the fact that there was sort of like a little symbol that to me represents the technology that we're using as well to keep the wheels turning, as we say. We also did a lot of just phone calling, getting on the phone, leaving voicemail messages. And again, like I said, we really wanted to reach out to grassroots stakeholders and just visit. So that was part of our outreach as well. Next slide. So how much of an impact did stakeholders have in the project? They had a huge impact. You know, it was kind of like every time, you know, we had to make another decision about the tool, it was sort of like the voices at the table from our focus groups, from our initial stakeholder meeting, our phone contacts, the kind of information that people were bringing to us through conferences, tabling, discussions, and so forth, that sort of reverberated in my mind to make sure that we were continuing to include those voices and that input. So it set the tone for the project. It provided input from a variety of professional backgrounds, which we felt was so important, like I said. When you look at all of those people providing input, that's a lot of experience, many years of experience if you look at it cumulatively. And we took that information to ensure the tool would be culturally appropriate in every way that's important, right? it's sort of our measure of success. We always looked at it and to rethink and make some changes as needed. And also the issue of victim safety was really critical. That was always at the forefront of our discussions and our planning. So it was very central to the tool as far as information, how we secured information to let people know how this information was going to be used, who was going to access the information. So that issue of safety was incredibly important. And all of this, we feel, as Renee said, really provided a lot of credibility to the tool. And it also stressed the importance of not recreating a web resource that was the same as others in a mainstream, but one that reflects a tool of tribal resources specifically. Next slide. So, you know, there's sort of for me in my mind, in my way of thinking, is that there's sort of underlying principles, right, that have to guide any project, and also in the process of identifying stakeholders and the kind of knowledge and skill sets that they would bring. So these were some of those kinds of factors that we considered in the kind of people that we wanted to reach out to, people that were knowledgeable about the needs of Native victims from Two-Spirit communities, Native relatives that live in urban areas, or Native people that live in urban areas. Oftentimes they're sort of forgotten, yet there's a lot of Native people that, you know, migrate back and forth from reservations to urban areas. And also people that live in the Alaska Native villages and their unique needs. There are many very remote places, remote villages in Alaska. So considering their needs and the need for them to access services in the most efficient way was also an ongoing part of our deliberations. Those knowledgeable about elder abuse and child abuse issues that I spoke about earlier, knowledgeable about the needs of victims of sex trafficking. So a lot of our resources we also took from at TLPI, we have a website that we created on sex trafficking resources for victims of sex trafficking from tribal communities. We also wanted to include the input of tribal leaders because, again, we wanted to provide a sense of ownership for Indian people all across the country, and that definitely includes tribal leaders, so that they in turn can encourage their service providers and other folks to provide input and to continue to utilize the tool, because that's who it's designed for. Victim service providers especially, we wanted to make sure that we were able to meet the needs of those, again, like I said, working on the ground, because oftentimes they have a need for accessing information quickly if they're working with a victim, and we wanted to be able to provide a tool that was easy to use and user-friendly, and the information that they would need is readily accessible. And again, like I said, tribal TA providers, because they have a wealth of information based on the work that they do with tribes, that programs that provide services to victims of crime. And from that, representatives from tribal coalitions. And also our partners at the federal level, we also wanted to include their knowledge, their skills, because they also have a lot of contacts, and they know what the needs are out there through a lot of different sources from the programs that they oversee and that they work with, which includes OVC grantees. We want to ensure that the OVC grantees also provide their needs and their beliefs about how the tool should be organized and so forth, the needs that they have as grantees. Next slide. So if this is, you know, a Native a tool that's based in within a Native way of thinking and belief systems, we have to have some guiding principles. So these were some that, for me, sort of were there all throughout. The belief that victims may need, seek traditional healing resources. When we had the focus groups, especially the one at the Indian Nations Conference in Palm Springs, I don't know if any of you have had a chance to attend that, but we had a focus group there a couple of years back, and we were able to get a lot of really useful information at that focus group. And, information about, including resources where Native people go for healing other than maybe therapy, right? Because more and more there's Native people victims of crime that seek those type of resources. So it's important to include those resources when they're available. Understanding that oftentimes English might be a second language for victims and may feel more comfortable communicating in their language. So wanted to make sure that if there are programs out there that provide services in another language besides English, that we include that as well. And that these resources are inclusive of Native people living in urban areas, like I mentioned before, also considering the unique needs of Alaska Native relatives living in remote villages. And also just understanding always that the existing national hotline services may not be culturally appropriate and aren't being accessed by Native people, which makes this resource really important. And, last but not least, we framed our consultation, the collection of information, development of a tool from a cultural belief that we are all related. So when we believe that way, then it's really important that we be inclusive of all the needs for services, because we're all related, that we help one another. We reach out and we're inclusive of all of our relatives out there and the needs that they have when they've been impacted by violent crime victimization. Next slide. So we had, like I said, many focus groups. I think we had, I want to say 5 when we were doing the planning. And so participants focused on elements that can indicate a program is tribal, Native specific. That was the theme that sort of kept popping up. If we're going to include programs within the tool that say they provide services to Native people, that could mean a number of things. A program maybe they say they provide services, but maybe in a year's time they provide services to maybe 2 or 3 Native people. And in a focus group, there was a lot of concern mentioned that, that may not be reflective of a true Native program. So these are some of the factors that were brought up that would indicate that a program is a tribal or Native specific program. A program affiliated with the tribe or that has received tribal sanction through maybe an MOU or an MOA. It's staffed by tribal members that are particularly reflective of that community. There are that it's sanctioned by a tribal coalition or affiliated with a tribal coalition, that there's a way to tell that they are including tribal specific values into their services, that they say that maybe in their materials somewhere or within their mission statement or their philosophy statement, that they have Native language speakers, for example, or they have translators available, or maybe some of their documents are written in a tribal language. They provide a listing of their funding, for example. What kind of funding do they receive? Are any of those funds specifically for tribal programming? And for non-tribal or non-Native programs, that they have an advisory group of Native tribal people. especially if they're based close to a reservation or on a reservation, that those kind of factors need to be considered if they're saying that they're a native or affiliated with a native tribe, for example. Next slide. And these were a few additional factors that would indicate a program is a native program, a native victim services program. They have traditionalists available to provide healing services, or that they have some kind of funding that may defray some of the costs for healers to come in. Many of them could be elders, they said, which they may be on very limited income, so providing a little stipend might be important. So finding out that kind of information, that they have cultural activities offered within the program, that tribal members are aware of the program. The mission statement includes serving Native populations. They have a link to a local tribal website, for example, especially that they have some connection with tribes located nearby that urban area. That they're very accessible, that their hours and location, if they provide transportation, for example. Oftentimes that's really helpful, especially to a lot of our elderly that need services and don't have transportation. And also, we need to make it easy to gather updates for the information. That was something that was made really clear, that we need to have access to information so that the information can be kept up to date within the tool. Let's see, also want to solicit comments on the website to show you are satisfied. So they, focus group participants, said maybe a way that they can start and evaluate, like a suggestion box or how to make the tool better. That was a suggestion that was made as well. Next slide. So like I already said, this was really time-intensive work, but you know what? I totally enjoyed it. Sometimes, it was involved a lot of hours just finding the right person to speak to within a tribal community. Even if you think that you found the program, you want to find the person who's going to be able to have the time to follow through. In a lot of tribal communities, they may have only one or two advocates, and I always felt a little bit guilty pulling their time away from the work that they're doing with victims. So maybe an admin type person who is more based in the office and has a little bit more availability in their time is a good person to talk to. Someone who's been in that program for a while, that has the knowledge about who to talk to, who to seek permission from, to get their program into the tool. There was a script that was developed, which I think it was really good, so that our message, the kind of information that we want to provide and what kind of information we're seeking could all be consistent for all the people doing outreach. But sometimes, it was good to go off script, as I said, to be able to just visit with service providers, to say, this is what we're doing. We're putting a lot of heart and soul into development of this tool for you and for other people like yourself. So a lot of that time was spent, especially during conference tabling, had a chance to just visit a lot of service providers. And this involved, like I said earlier, a lot of email messages, a lot of phone calls, leaving voicemail messages, so many hours of work. And at conferences especially, helping people complete the inclusion form as they stop by the table. At Indian Nations Conference, we actually had a room, we had laptops set up where we could actually, go through the form with them. There was a couple of times, even at a couple of conferences, there were folks that stopped by that were sort of a little older and not real comfortable with the technology. So I just sat down and typed information into the inclusion form. Of course, after first explaining, about the tool, answering any questions or concerns they may have, because I don't want them just to you know, just because they know me or we've had a prior relationship, a working relationship, that they trust me, so they're just going to give me all this information. I wanted to make sure that they knew about the tool and its purpose. So continued outreach to hundreds of folks who are busy, who need information about the tool. Oftentimes they have to seek approval from others to complete the inclusion form, and then also answering their questions about the form and the tool. So this is all the work that went into gathering the information for the tool. But it was good work. Next slide. I'm going to turn it over to Renee from here. Thank you.
Thank you so much, Bonnie. I hope everybody's had a chance to jump on the website. I put it in the chat box for those of you who haven't had the opportunity to go check it out. So you've heard from Heather and Bonnie and Abby a little bit, talking about their role, their very important role. But continuing forward, especially with COVID, our outreach efforts, we've had to become creative since we can't do our gathering and, you know, our meeting in person. And as Native people, that, you know, that face-to-face contact is very important to us. And so we've had to get really creative on these webinars and all of our technology that we have available to us. I'm grateful at least we have that. And TLPI has worked diligently updating and following up and ensuring that we're maintaining, you know, updated information for the tool. And that is one thing that COVID has given us the opportunity to do, is to have more time in the office to email people, call, follow up, you know, and it seems like that people actually have the time to get online now and make sure their information is up to date. So that's been a positive, I guess you could say, with COVID. The National Center for Victims of Crime Tribal Division, we're the host agency for the Tribal Resource Tool. We are the actual OVC grantee, and that's part of Gail's her responsibilities as the director is she directs the project team, she manages the budget, and she takes care of all the DOJ reporting responsibilities. So that's all handled in-house with NCVC. Me as the program manager, I manage the Salesforce database and the online mapping tool on a daily basis. So a lot of things that Bonnie talked about with the stakeholder concerns, that is basically my role day to day, is just making sure that I'm following up. And, you know, we do that with a personal touch, because we will go into the tool, get the contact information, and make sure we're emailing people or calling them and making sure that that information is still up to date. And it's been really, really successful, because the good thing is we're finding out that there are a lot of programs, like Bonnie said, that we find have been in existence for a really long time, and those folks are still, you know, operating those organizations. So that's a good thing to see, especially in Indian country. I do know that some of the stakeholder concerns in the beginning, one thing that I wanted to mention was like what we do with the information. And we did talk a little bit about when we do our follow-up and when we're vetting. You can go to the next slide, Megan, sorry. When I'm doing the vetting process, is to make sure that people have entered their information in the appropriate sections. Let's say a domestic violence shelter. I know that was a great concern for a lot of the stakeholders, was putting a shelter on the web. And what we do is we just like to make sure that that information is available in the general area, because in your search, you have like a 200-mile radius, right, to search for resources. And we do our due diligence to make sure that we do not have identifying information for those types of locations. And that's one of the things that I take great pride in when I'm vetting the process. And I have seen an agency that was a shelter, and they had transposed their information, the private information on the public and vice versa. So I was able to make that switch to make sure we kept that location confidential. And I contacted the shelter manager and just informed her of that, you know. So she was really appreciative that we were able to do that. And that is something that I do on a daily basis. We do have programs in the tool that are just kind of sitting in limbo because they do not meet the criteria to be eligible in this program for different reasons. They may not have, something specific in their mission statement, or they don't have information pertaining to actually serving Native Americans or Alaskan Native victims. So we will make that personal contact with them to see if there is other information they could provide that would actually, make them meet the criteria. So we really do our due diligence to make sure that that criteria is met and everybody in there is fulfilling the original mission and intent of what the stakeholders wanted. So we're really proud of that process. Next slide, please. I'm going to turn this over to our partner, Gwen, our research expert, who's going to talk a little bit more about the research aspect.
Hi, everyone. I hope you can hear me this time. Apologies, my audio cut out earlier. As Renee said, my name is Gwen Evans-Lomiesta. I am a researcher with the National Congress of American Indians Policy Research Center. And an important note here is really that this tool is created to be useful for victims and advocates on the ground. That is its primary purpose. And it was not created to be a research study. So as a result, there's only so much information that can be pulled from the data and relayed to the rest of the United States. This was among a concern by stakeholders of what was going to be interpreted from this. And it is an important disclaimer and note that because it was created and formed specifically for victims and advocates, that focus has shifted it to make it where it cannot be treated in such a way that it is a research study. And with that, I'll pass it back over to Gail.
It's really neat to see all of your names in the chat box and locations. I loved the comment by one of you that's in the process of filling out the inclusion form as we're speaking. That's great. If we were in person, we'd find a cool prize for you. It's really cool also to see several different nations represented there, as you all being in attendance today. And many of you, I recognize your names. I've had the privilege, the honor of working with you over the years. It's great to see several of you from Alaska. We do have a number of Alaska resources in the Tribal Resource Tool. We encourage you to take a look and see who else should be in there from Alaska that isn't. In fact, we encourage all of you from your areas to do that. A couple of folks from Hawaii even, so that's welcome. We're pleased to have you. And our prayers go out to all of you in the areas of the fires. I see several from the Washington area and others where we're having to battle the fires. So welcome and thank you for making time to be with us this afternoon. There's been a lot of interest in our slides, PowerPoint slides, and in the recording, and so we'll make those available to you. And you've heard now from Heather Torres, from Bonnie Claremont, from Abby Theonis, and you'll be hearing more about TLPI's role as we go along here. Renee does an excellent job managing our database and the actual map online. And again, the address is on every slide, tribalresourcetool.org. Please don't hesitate to hop on and take a look at it and see who all's listed on there from your area, and make sure that you are, if you meet the inclusion criteria. And Renee is now going to talk to you just a little bit more. She's already kind of covered the vetting and approval process. Renee, do you have anything else you'd like to add on that?
I think we can talk a little bit about the different agencies that are in there because we get a lot of questions about specific agencies that may not be in there. Um, and, you know, if we could include everybody, that would be fantastic. And maybe someday we can, you know, make additions to this as we go along. But I mean, right now you can go into the tool and it will give you a list of questions to answer to see if you meet the criteria that I've already talked about a little bit. But we have a broad array of services and service providers listed in there, from law enforcement to direct service providers, indirect service providers. We have nonprofits. Uh, we have, did I already say law enforcement agencies? We have tribal coalitions. I mean, there is a huge array of services. And the reason that I think that the stakeholders, you know, in all their great wisdom, knew what they were doing when they set that process forth to make sure that we could really reach out to Indian country because, you know, as a Muskogee citizen, I don't live on my reservation right now. I live adjacent to it, but I don't live on my reservation. And I just recently moved from the Fort Berthold Reservation in North Dakota back home to Oklahoma. So, you know, being able to access services when you're in a different area, um, it may not always just be a victim service provider that you need to access. So I think they did a really, really great job in implementing, you know, a broad array of different disciplines. We have a ton of medical services, not just for like, you know, emergency services, but for, you know, SANE exams or for mental health, for behavioral health, substance abuse issues. So we tried to cover, you know, every aspect that a victim, a family member, or a service provider might need to seek out to provide services to a victim. And, you know, in my previous life, I've just until the last year and a half when I came to NCVC, most of my work has been done in the field, boots on the ground, as a federal victim specialist or a police officer providing services to victims. And having something like this when I was doing that work, man, I wished I would have had that because you know, I served a lot of different reservations, and in my job we were detailed to, you know, a lot of different areas. And when you go to a different area and you don't know anybody there, it's difficult to navigate, you know, the services that you need to serve your crime victims. And having something like this, I wished I would have had this because that would have made my job so much easier to make sure that I could have, you know, got these services to my victims immediately. Because it would have just been at a few keystrokes on the computer or on my cell phone to find services. So just coming from that field experience, it's just invaluable how to have access to this. And I think that's why we coined it as it's a web-based lifeline for crime victims and survivors, because if you're needing those services immediately, no better way than to jump online to find something, right? So a little more about vetting. Privacy is a big thing to everybody, obviously in this line of work, and confidentiality. So we really like to reiterate, and I'll probably say it more than once through today and maybe tomorrow, that the information that is within Salesforce database belongs to the National Center of Victims of Crime, and that is not shared outside of our project. So that information remains intact and is not made available to anybody. I think that is it for me on this one. So next slide, please. And I'm going to turn this over to the National Congress of American Indians partners, to Kelby and Gwen, for you to carry on.
Perfect. Thank you so much, Renee. I really appreciate it. If we could move forward, I believe we have 2 more slides. Megan, just 1 or 2 more slides. 1 more, perfect. Move back one. Thanks so much. Sorry, it's you know, it's all the fun things about live webinars. So just a quick reminder, my name is Kelby Kennedy, and I am a citizen of the Choctaw Nation of Oklahoma. I work for the National Congress of American Indians as a policy counsel. And I didn't mention this earlier, but some of the policy areas I work on are public safety and justice for NCAI. I work quite closely with the NCAI Violence Against Women Task Force, and then I also work in juvenile justice. So it's been really great to see the resources in this tool grow, because we are well aware at NCAI that violence against Native women and Native people in particular is really pervasive, and making sure that we can actually get services to our people is very important. So with that being said, I'll turn it over to my colleague Gwen, and then we'll talk a little bit more about NCAI and what we actually do in this partnership with NCVC and TLPI to bring the Tribal Resource Tool to fruition.
All right, and hello everybody again. My name is Gwen Evans Lomiesta. I am a researcher in the NCAI Policy Research Center. I am Hopi, and I partner with Kelby on a lot of our projects. Particularly, we've worked on both this project for victim services together. We work on juvenile justice together, and some of my other areas of focus have been particularly the census and minimal on climate change. So back to you, Kelby.
Perfect. Megan, if we can move to the next slide, we're going to talk a little bit about NCAI. For those of you that don't know what NCAI is, we are the oldest, largest, and most representative American Indian and Alaskan Native organization serving the broad interests of tribal governments and communities across the United States. So NCAI was actually created in 1944 by tribal leaders. This is a time period during U.S. history where the federal government was trying to terminate tribes, and so tribal leaders came together and created NCAI to fight back against termination. We are still truly a Congress of tribal nations, so when it's safe for us to come together, I hope that you come see us at one of NCAI's 3 conferences that we host every year. We have 2 conferences that move around Indian country, and one that's based in D.C., which is our winter conference. During our conferences, tribal leaders come together to pass resolutions on a variety of topics, including victim services and violence against Native women, and a variety of other issues, to tell the administration or to tell an agency, hey, you need to do X and Y, or Indian country's voice is X and Y. We truly serve as a voice for all of Indian country. And so those resolutions go through a subcommittee process and a large committee process, and then are voted on by our general body. I then take those particular resolutions as a policy staff and then help bring those particular outcomes. So asking the administration to do X and Y, that's my job if it's in my policy area, to work with others to make those things happen. We also do some really great work on the ground in Indian country in terms of technical assistance, and then we also do some fantastic work in the area of research through the Policy Research Center, as Gwen has said, that she's a part of, and our Partnership for Tribal Governance. And I'd love to touch base here in just a moment on some great research that Gwen is doing. And Megan, if we can move to the next slide, we'll have Gwen take over.
All right, so the NCAI Policy Research Center is part of NCAI, and the Research Center was established in 2003 as a national tribal research and policy center to focus on research and data to support and inform the policy development efforts of tribal leaders, tribal organizations, Congress, the administration, and other policy institutions serving tribal communities. The Policy Research Center works under a national advisory group, and they help guide where our research priorities are each year. The mission is to provide tribal leaders with the best available knowledge and data to strategically make proactive policy decisions and have a framework of Native wisdom that positively impacts the future of Native people. Next slide.
Perfect. So NCIACs Role within NCVC and this particular tool is really in 2 buckets. So you have an outreach bucket, which you'll see here. There's a couple of photos of myself and a couple of our former teammates doing some outreach at tribal conferences. We have this really great setup where we actually sit at tribal conferences and at consultations. And we have a lot of resources from the tool. We have information. We have actually, after this photo was taken, we have a lot of really great prizes that you can utilize to see the information, but also, you know, it's everything from highlighters to things that you put on your phone just to really make sure that you have the information of the tool and help bring people to come to talk to us about the tool as well. So having in-person conversations, as Bonnie said, is really important, and we really wanted to make sure to connect with tribal leaders and service providers at all of these conferences. As you see, there's a computer that we would set up next to the table so we could help walk people through the tool, how to utilize the tool. If you are not from a particular service provider, but your tribal nation actually has information that you would like to share, that is perfectly fine. Reach out to Gail, reach out to Renee, reach out to any of us on the last slide here. We'd be happy to reach out to that particular tribal nation. I know for Choctaw Nation, I did a search in the tool early on and found that there were particular things from my own tribal nation that were not in there, so I was able to help connect us with our nation to get more resources put in there. So don't feel bad if you're not, you can't enter information about a tool, or information about a resource. Reach out to us. We're happy to make sure to get that into the tool as well. So that's just one component of NCIA's outreach. And additionally, we're doing some digital outreach as COVID has changed all of our world. We've transitioned a lot of our outreach to just be digital. And so NCIA will be tabling at the upcoming government-to-government consultation with the Department of Justice coming up on October 27th through 30th. That's a consultation on violence against Native women. It's the yearly consultation that's mandated by the Violence Against Women Act, where it requires DOJ, the Department of the Interior, and Department of Health and Human Services to consult with tribal nations. So there will be a resource room, and NCAI will be in that resource room, handing out copies of the report, talking to people about all the interesting pieces of data. And we want to make sure that we answer your questions as well. So please come to the consultation. Please come see us in the resource room. We would love to see you there and talk more about the research. Speaking of questions, before I hand it back over to Gwen, if you have questions about any of the things that you've heard here today, I've seen a couple of questions in the chat, I've seen a couple of questions in the Q&A. If you don't feel like putting those in those particular boxes, send me a chat directly, and I will make sure to have a logging of the questions here at the end, and then we will turn to our panel and we'll answer any questions that you have. So if you don't feel like putting things in the general chat or in the Q&A box, just feel free to send them to me directly, and then we'll read them at the end and get some answers for you. So thank you so much for being here today, and then let's talk about NCAI's other work regarding data analysis. And if we can move to the next slide, please. Thanks.
Awesome. Thank you, Kelby. And so as Kelby mentioned, we have reports that are coming out, and this is part of our work on the Tribal Resource Tool. So the first report, which has been recently released as of a week ago, 2 weeks ago, very recently, has been a review of available data and literature on services for American Indian and Alaska Native victims of crime. And so the first report really does set the stage and the foundational knowledge for what data is available, and really identifying what data isn't available that is necessary to be able to measure what the gaps are in services and whether or not individuals are able or not able to access services, because these are all key pieces of data that do impact how people make their policy decisions and how they determine what kind of services and where they need them. The second and third reports are covering really data that comes out of the Tribal Resource Tool. Again, these are comparative of a year's growth of the Tribal Resource Tool, and all three of these reports will be discussed during tomorrow's webinar more in depth. And we do encourage you to attend tomorrow and learn more. So next slide. And I will hand it back over to Renee.
Gail, can you pick that up for me, please?
Actually, it's Heather and Bonnie and Abby's turn now.
Yes, and I definitely want to be mindful of time to make sure we have plenty of time to get to those questions and answers. But I will ask my fellow TLPI team to pull up their videos and with me here for our TLPI overview. I miss that camaraderie of presentations and that environment, so I'm going to ask them to do that for us. Let's go to the next slide, Megan. So for those who may be unfamiliar with TLPI, we are a 100% Native American operated nonprofit corporation organized to design and deliver education, research training, and technical assistance programs, which promote the enhancement of justice in Indian country and the health and well-being and culture of Native peoples. Our mission is to enhance and strengthen tribal sovereignty and justice while honoring community values, protecting rights, and promoting well-being. And our vision is to empower Native communities to create and control their own institutions for the benefit and welfare of all community members now and for future generations. We have our home office in West Hollywood, California. We also have our offices in Minnesota, where Bonnie and Abby right now are kind of fluctuating in and out of the office. And we have tons of remote staff and consultants that we rely on to really put us in the best place to offer these educational and technical assistance programs. And we are so honored to be part of this project to create and populate the tribal resource tool. Next slide, Megan. Here's just a quick overview for folks who may just be checking out our PowerPoint slides afterwards. These are all of our affiliations. Bonnie is our Victim Advocacy Program Specialist. I'm a project director at TLPI, and Abby is our program assistant. Next slide. And I think, Renee, we kind of touched a little bit on vetting and approval process, and we're kind of going towards the time. So I'm just going to go ahead and skip this slide here to allow Abby to talk a little bit more about the verification. One more slide, Megan. And just one more overview, as Bonnie mentioned, lots and lots of time was spent visiting, calling, outreaching, emailing, sometimes every other day. We, we tried to venture and walk the line of, bugging folks while also trying to make sure we're getting the best information and all of the tribal programs into the resource tool. We definitely work with tribal coalitions. We engaged all of our personal and professional contacts. We're really missing those conferences, huh? And tabling and just talking with people and visiting and just spending that time with each other. This slide, Bonnie mentioned this resource that we really relied on to do some cross-checking for us as we outreached on the tool. It's our Sex Trafficking in Indian Country Victim Survivor Resource Book. Now it is from 2016, so even when we went to check, we realized that some of the resources there need to be updated. And that's what we want to, a lot of our stakeholders identified as well, as Bonnie mentioned, was just trying to, if we're gonna make this tool, let's keep it up. So the future of the tool will be discussed a bit more tomorrow. But we wanted to highlight and hyperlink that for you all. It's available online as a free downloadable PDF. Again, that's Sex Trafficking in Indian Country Victim Survivor Resource Book. And the other work on outreach was just doing independent research, hopping online, trying to figure out, having conversations to make sure we're walking through those stakeholder concerns that Bonnie laid out earlier. Bonnie, anything else you want to add on this one?
I don't think so. I think you covered it.
Great. And then we'll go to the next slide, Megan. Abby?
Hi, everyone. This is Abby again from the Tribal Law and Policy Institute. Renee touched a little bit on this slide earlier, but recently after the coronavirus kind of hit in the US and a lot of people were moving remotely, everyone on the Tribal Resource Tool project was, really getting going with outreach, and we were really being able to connect with a lot of people. And so I was actually tasked with going through the programs that were already in the tool to make sure that we had the most up-to-date information. So what I did is I just went into our database of programs and I started alphabetically by state and just started reaching out to everyone that was in the tool, asking them, if their information was up to date, sending a link and the information that we had, seeing if they had any updates, really anything along those lines to make sure that we were providing the most up-to-date information. And if anything was wrong, we updated it right away so that it could be fixed in the tool and so that the public information in the tool was the most up-to-date. And we actually recently just finished that, and thankfully there was not too many updates. So we are keeping the most up-to-date information that we have and that programs have for us.
Great, thank you, Abby. Can we go to the next slide, Megan? And this is just reinforcing that idea of maintenance, and we really hope that this is something that can be kept up after this grant period is over through NCVC. And again, we know the importance of keeping the most up-to-date information is critical to survivor safety, to victim safety, and we want to make sure that that's prioritized in the future. And TLPI was very honored and humbled to be able to be part of that work these last few years. Thank you very much, and we're going to hand it off to Kelby. And we can go to the next slide,
everybody.
Megan.
Perfect. Well, thank you so much, everybody, for joining us this afternoon. I know that, amongst all the hustle and bustle of things going around the world, we do have time to fit in tons of webinars. So I'm glad that you've had a chance to actually join the webinar today. Just a quick reminder that today we covered the history of the Tribal Resource Tool and the research that will be coming out. Tomorrow, we are really going to walk through how we're actually going to be able to use the tool. So we'll walk you through finding resources and wraparound resources for victims out in Indian country and other areas throughout the United States. What we can expect from the 3 reports that will be coming out for NCAI in regards to this tool, and then what is going to happen with the future of the Tribal Resource Tool. So at this point, I've been scanning all of your information in regards to questions. So I'm just pulling up the form right now that I've been copying and pasting everything into. So for everybody on the panel, actually, Megan, can we go to the next slide as well? Awesome. So I do have a couple of questions here that came in on the broad chat and the Q&A section. So I'd like to direct these at a couple of people first. So for the entire panel, we got a question that says, is it okay to suggest local crime victims, DV orgs in my community to explore and getting their organizations listed in the tool, the various tribes and tribal members in my community? So actually, you know what, I'll turn that question over to Renee to answer.
Okay, thank you, Kelby. And we are getting so many good questions. I'm like putting my typing skills to use. So I would encourage you to jump on the tool and look at the criteria eligibility questions. And that should give you a good start to know if you're going to be eligible. In short, you do not have to be a tribal specific program to be entered in the tool. If you are funded to serve Native American, Alaska Native victims, or if you are work in an urban Indian area, I know I've worked on a lot of reservations and we didn't have a lot of services there, so we had to rely on traveling to the larger cities. Those programs are going to be eligible because you are going to provide a service to crime victims and survivors, to Native crime victims and survivors. So if you have any problems whatsoever with feeling like your program is going to meet criteria, I would encourage you to contact me via email. I'm going to put it in the chat right now. And you can email me if you have questions, and then I can go over that with you, because I did see somebody had a question as to why their program was not eligible or wasn't in the program. And to be quite honest with you, I don't think I saw that program in the tool. And we have glitches like that also. Technology is great when it works, right? So if you have a concern about your program criteria eligibility, shoot me an email and we can make some time to get that sorted out and get you in the tool.
Great, thanks so much, Renee. The next question that I was able to pull out of the chat and the Q&A is the NCIA report that was mentioned available to the public? So I don't know, Gwen, if you want to talk about the report and how it will be distributed, or I'm also happy to touch base on this as well.
Sure, I can jump in here. So the first report is currently available. It can be downloaded by anyone. We have it posted on the NCIAI Policy Research Center website. I believe the link was linked in the chat. We can share it again. This is just for the first report. The second report is currently in the review process, and hopefully once it does get all of its final reviews, again, we'll be able to make it public and release it. We will have announcements I'm sure NCVC will have announcements, but we will also through the NCAI Policy Research Center. And if you want, you can get updates from us about any new publications by emailing research@ncai.org. I'll put that in the chat, and that's how to be added to our listserv. You can also follow us at Twitter. I believe our Twitter handle is @NCAIPRC. And so again, that's the first report with the available data and research.
Perfect. Thank you so much, Gwen. Another question that I have here is, how can people help spread the word about the Victim Services tool? And I'm going to direct that to Gail and Renee.
I'll jump in first. That's actually a very good question. And we encourage you to put our link on your website. We encourage you to share this information in your multidisciplinary teams that you might be a part of. Any of your groups that you think that it would apply to, we encourage you to share it. I appreciated someone commenting in the chat about sharing it with their local law enforcement agencies, and that's actually a real good way of doing it as well. Renee, what else?
I like to encourage people, if you are in Indian country, I think that if you can reach out to your tribal media folks, because so many of us have our own newsletters and radio stations, and that's a great avenue to get the word out to people is, you know, a little blurb in the tribal newsletter. I can send you graphics if you're willing to do that. If you ever need a flyer or anything, like I said, shoot me an email and I'll be able to help get that out. But I think those are really unutilized resources that I'm finding out. And I did want to respond to Lucy Drake. So I saw your chat, and if you can shoot me an email. I don't know why that's not in there. Like I said, technology is great when it works, right? So you and I can get together and we can get that worked out.
Great. Thanks so much, Renee. Moving on to another question I have here. What federal agencies can help with this work? As this is, you know, making sure that victims actually have resources out in Indian country. And I'm going to turn that question over to Renee and then our team over at TLPI, Bonnie, Abby, and Heather.
Okay, that's another great question. So our federal partners, in terms of, we know that a lot of the major crimes that are listed in the TRT, if those occur in Indian country, those generally are prosecuted by federal entities. So we have to work closely with our FBI, Bureau of Indian Affairs, U.S. Attorney's offices, and most importantly, and a big shout out to a lot of my former colleagues that are on the call today, our FBI and BIA victim specialists who provide a really great service on all the reservations. Having them listed in the tool as partners is such an important piece to victims accessing service and having that go between the tribal and federal systems. So our federal partners absolutely play an important role in Indian country crime victims. Gail, did you want to add anything to that?
One thing I might add is that several of our federal agencies serve Native Americans, and they may not be victim service providers, but you may come into contact with them for another purpose. And so actually most of our federal partners, I think this would apply to anyone that is interacting with American Indians or Alaskan Natives.
And that's a good point, because a lot of our medical facilities are federal Indian Health Service medical facilities. So sometimes when we have folks that enter those programs, sometimes they'll enter themselves as a medical facility. Sometimes they'll enter themselves as federal government. So I think it depends on which portion is being entered from IHS is how that's listed. But that's a really good question.
Thank you so much for your answers. We're going to move on just quickly. We've got about 3 more questions that I have pulled out from the chat and other places. And in regards to the next question, I have, what can tribal nations do with this information? And so I'm going to turn it over to Gwen first to talk about how the information in the report could be helpful for tribes. And then after Gwen, let's turn it over to Renee to talk about the information in the tool and how that could be helpful to tribes.
Sure. So I go a little bit more into this tomorrow during the webinar, the second part of the webinar, where I go a little bit more into the different reports and what's looked at, and really how the data has already influenced even the tribal resource tool and adjustments to that. Really what the data can do is it can help inform different tribal leaders. You know, these are the resources in our area. Maybe they have firsthand knowledge of, you know we may not, have the empirical data here, but we know that this type of crime is an issue and we're not seeing anything in the surrounding areas for this crime. And so it can help fill in those gaps as well. So this really is, the data is there to help inform people to try to make their policy decisions to improve the areas and provide the services that their victims might need.
Renee?
And real quickly, in essence of time, we know that partnerships, relationships are very important to us as Native people as a whole, but also in the victim service world, you can't do this job alone. To serve victims appropriately and trauma-informed, you have to do it collaboratively. So I look at this as a giant address book sometimes. If I'm just needing to reach out for somebody, a guest speaker, sometimes I have jumped into the tool and said, hey, let me look and see who's, in this area. So it can serve as a multitude of, resources for you.
Very quickly, I'm going to turn over this next question to Bonnie over at CLPI, and this question asks, what is done with the information submitted regarding the number of victims served? Oh, Bonnie, you might be on mute.
Oh, what was the question towards the end? It was sort of muffled.
Yeah. Oh, so sorry about that. So the question is, what is done with the information submitted into the tool regarding the number of victims served? So the individual programs information about how many victims they actually served.
Oh, I don't know. I don't know what. I don't cover that part.
Oh, I will turn it over to Renee then. For some reason, I had you in mind as like the guru on the info, and so I will definitely turn that question over to Renee.
So, and the reason that question is there, and Bonnie could probably answer the part from the stakeholders, because we wanted to make sure, the stakeholders wanted to make sure that if you were not a tribal specific program, that you were credible in serving Native victims. So the information is mostly just to give a little validity to your entry, and we don't do anything with it. That's kept internally, and that's actually used as part of the vetting process. So if you're not a tribal specific program, that just gives me one more item to check off that gives you criteria eligibility. So good question.
Yeah. Well, with that being said, we are done with questions. I'm going to turn it over to Gail to finish this up for today. And thank you so much again for joining us. And we hope that you're going to be able to come see us tomorrow afternoon, where we actually walk through the tool, we walk through reports, and then see what's next for the Tribal Resource Tool. So Kipi Silakati and Yakuke, thank you so much, and we'll see you again later. And I'll turn it back over to Renee, or to Gail, for our final sign-off. And Megan, can you please move to the next slide?
Here is all of our contact information. Don't hesitate to reach out to us if you have a question or a concern. You all have been an excellent group. We've had a lot of you on the call, and you've been very active in the chat and in the question box. So thank you so much for that. We'll be getting you out an email with the resources and anything that we've promised in the chat box. Tomorrow will be very important. If you can at all, I encourage you to join tomorrow. And we just want to thank OVC for the funding for the Tribal Resource Tool, because we do realize it is serving a lot of victims. Over 600 times a month it's being searched. So please continue to share that information so that it can contribute to the healing of victims and survivors. Thank you again for joining us.
Kunda, yeah, thank you. Take care, everyone.